Hello everyone and welcome back. So in this video we will discuss the Guillain-Barré Syndrome. What is Guillain-Barré Syndrome? It is an autoimmune disorder which leads to progressive paralysis. It is the common cause of acute flaccid neuromuscular paralysis worldwide. Guillain-Barré Syndrome is known as GBS and it is autoimmune disorder and progressive paralysis occur in it, and the common cause of acute flaccid neuromuscular paralysis worldwide is Guillain-Barré syndrome. It is more common in male as compared to female. Now the causes are influenza vaccine, gastrointestinal and respiratory infections, surgery and trauma. These things lead to GBS, which is Guillain-Barré syndrome. If gastrointestinal and respiratory infections occur, it leads to GBS. The pathophysiology is that this is immune-mediated process. It occurs post-infection. Remember this thing, the GBS always occurs post-infection. It appears related to the molecular mimicry. That is ganglioside antibodies. Bacteria and viruses look like proteins of own body in nervous system, and it leads to the formation of ganglioside antibodies and cause GBS. Outer membrane of Campylobacter is made up of lipopolysaccharides which resembles gangliosides. So, in this way the GBS occur to post-infections, that is bacteria and virus look like proteins of own body and it leads to the formation of ganglioside antibodies which causes GBS. The clinical features of GBS are gastrointestinal infections, that is Campylobacter jejuni, which is common for 1 to 6 weeks post-infection. Respiratory infection is the clinical feature and it is 1 to 6 weeks post-infection. For example, influenza. Acroparesthesia, that is ascending weakness and paralysis occur in GBS. Areflexia or hyporeflexia occur, and the loss of proprioception and vibratory senses occur. If spread to the diaphragm, then it also causes respiratory failure. Autonomic dysfunction also occur. Blood pressure dysregulation, urinary retention, cardiac arrhythmias, sinus tachycardia, causes of the morbidity and mortality, altered mental status, dysphagia, facial nerve involvement, and neurogenic pulmonary edema. These are the clinical features of GBS. So, as we have studied that GBS occur post-infectious. So, these post-infections are gastrointestinal infections. After 1 to 6 weeks of gastrointestinal infections, the clinical features of GBS appear. Same goes for respiratory infection. Acroparesthesia occur, that is, there is ascending weakness and paralysis of the feet in GBS. Areflexia or hyporeflexia occur. There is loss of proprioceptions, and if it is spread, the infection is spread to the diaphragm, then it is also it can also cause respiratory failure. Autonomic dysfunction, blood pressure regulation, urinary retention, cardiac arrhythmias, sinus tachycardia, and the cause of morbidity and mortality, altered mental status, dysphagia, and facial nerve involvement, and neurogenic pulmonary edema. All these are the clinical features of GBS. Now, the specific investigations that are done for GBS are clinical diagnosis, that is, the patient is diagnosed as clinically from his clinical features. For example, there is areflexia, or there is neurogenic pulmonary edema, or facial nerve involvement, or the main feature is that there is acroparesthesia, that is ascending weakness and paralysis. So these are the features of GBS. So clinical diagnosis is done. The diagnostic criteria is that there is progressive symmetric weakness of greater than one limb. There is hyporeflexia or areflexia. There is progression which is less than 4 weeks, and there is symmetric weakness. EMG and nerve conduction test, that is conduction block, decrease, F wave, and these are the EMG diagnostic points for the GBS. Lumbar puncture is done, in which WBCs are normal, but the CSF protein is elevated. So these are the investigation options. That is clinical diagnosis. Then the diagnostic criteria is that there is progressive symmetric weakness of the limb, There is hyporeflexia or aeroreflexia, and there is symmetric weakness. The treatment options are better to administer within the 4 weeks of symptoms onset, best within the 2 weeks. Intravenous immunoglobulins are given, plasmapheresis is done, intubation due to the risk of respiratory failure is done, and avoid steroid use in GBS. Milder Fisher variant GBS, there is ophthalmoplegia, ataxia, and aeroflexia. If these three features are present, then it is milder Fisher variant GBS. So these are the treatment options that we have discussed. That is, it is better to administer the treatment in the first 4 weeks of diagnosis. Intravenous immunoglobulins are given. Plasmapheresis is done. Intubation is done due to the risk of respiratory failure, and steroids are avoided. So this was all about the GBS. GBS is autoimmune disorder and it stands for Guillain-Barré Syndrome, and this occurs post-infection. And the main symptoms from which we can diagnose the case is clinical diagnosis, and that is acroparesthesia, hyporeflexia, aeroreflexia, and other symptoms, that is tachycardia or arrhythmias or altered conscious status, urinary retention, etc. So this was all about GBS. Thanks for watching.